So hi, we're about to start another hair transplantation for this guy who's balding. He's in his late 20s. That's a plan that we've done. This is going to be a scarless, sutureless, safe, predictable technique. FUE, follicular unit extraction. What we do here is a team approach. We're going to do this in the operating theater. You can see in the following video our setup and how the teamwork is done to get the best results for our patients. It's time to give local anesthesia now. So it's loaded, kept, and then Valilala, Asyamringa. So you see it's injected slowly on these diabetic syringes. So the good thing about these local anesthetic agents is that it's long acting. It makes the area numb for about 14-15 hours till about tomorrow morning. So once the procedure is done and the patient can then go home with no pain, and then we put them on pain medications that then takes over. So they eventually don't feel any pain once these blocks are given. And after these blocks, we give a lot of infiltrations. I'm going to show you how the infiltrations are loaded and kept. And these are on slightly bigger syringes, all of them disposable. And then these are all the different fluids that they are. The tumescence, the local anesthesia. This is a Petri dish on the eyes, so we put the follicles back on. And all of this is done in the OR, operating room, the proper monitoring of the patients at all time. So those are all hair follicles coming out. So earlier the punches were made. Let me show you also how the punches are made. This is a painstaking process. You have to keep repeating this till you have 3,500 of the follicles out. So it's probably now about 200. And then it goes into this bowl. And from this bowl, goes to the other team that separates. Chart cutter. One.
ஒன்று
So that's just done now, and you can see all the grafts and how it's placed. That's the bandage from the donor area. உங்களுக்கு வலியில இல்ல?
வலி இல்லை.
மரத்துன்னு இருக்கு.
மரத்தும் அப்படி இல்லை.
நார்மலா இருக்கு.
ரைட்டா.
Perfect.